am very much pleased to invite Dr. G.G. Gangadharan, Medical Director, Institute of Ayurveda Interactive Medicine Care Center, FRLHT, Bangalore. He is Senior Editor of Journal of Ayurveda and Integrative Medicine. He was formerly Senior Vice President of Arya Pharma, Coimbatore. He is a member, Scientific Board, CCRAS. He is editor from India to Oxford on evidence-based complementary and alternative medicine published in UK. He is contributor to several books in Ayurveda and traveled all over the world, US, UK, Germany, China, etc. Dr. G.G. Gangadharan.
My respectful pranams to every one of you. Before dwelling into the subject, let me take you to a very insightful and relevant prayer in Rig Veda, which gives us an idea about our perspective on health, which to me looks very comprehensive. It says, Shadam Jivema Sharada, Shadam Adhina Syama Sharada, Shadam Prabhavama Sharada, Shadam Jivecha Sharada Shadam. Let us all live together for 100 years to enjoy the beautiful season of Sharad. Let us all live together in a way where all our motor organs are functional to the optimum level. Let us all our sensory organs are also effective and functional. In that way, let us live a full life for 100 years enjoying the phenomenal world. This is a prayer which was invented thousands of years, which gives an idea about how we look at health and life. Later on, if you look at again a contemporary text of Ayurveda 300 years back, it gives a very meaningful 15 signs and symptoms to understand health very objectively by an ordinary person on the street. It says that Tad Lakshanam Panchadasha Pragara, there are 15 symptoms to understand whether you are healthy or not. Ahara Kamksha, appetite, Sodanam Vibhaga, digestion in the proper way, Purisha Mutra Nila Srishtadacha, release of eliminatory things from the body on time without any effort, the 3 types of malas, Tadendriyartha Grahaneja Shakti, all the indriyas should be in a proper optimum functional level, Manasukhatvam Balavarnalabha, 2 important aspects of mental and physical health, Manasukhatvam, Bala Varna Labha, Labha of Balam, strength, and Varna, texture of the skin. Very important indicator of health, texture of the skin. Swapna Sukhena, Pradibodhanam cha, sleeping on time without any effort, sound sleep. And Sukhena Pradibodhanam, jumping out of the bed in the early morning without any effort. No backlogs. So this gives a very good idea that how we look at health. And health is very comprehensive to us. Health is a tool for the body to take our life to a different level of appreciation. We believe life is not complete here. So this is the very basic background in which Ayurveda looks at health. And public health, by definition, has nothing to do with medicine or very little to do with medicine. Public health is nothing but a science and art of preventing diseases or prolonging life and promoting health through the organized efforts and informed choices of society, organizations, public and private communities and individuals. See how important this concept is. From that concept of public health, which is the most modern definition of public health, we have come to a level of public health which is distribution of certain items, materials, commodities to help you to carry your health in a better way. So this is the background in which we should see public health and Ayurveda's approach. Ayurveda is basically a science which is promotive, preventive and curative. Ayurveda is rich with aspects of prevention of diseases and promotion of positive health at mental and physical level. From this concept, if you look at public health, we will be surprised to see that how Ayurveda even is getting distorted in the name of public health. And Ayurveda consider the human being as the part of the external universe. We say that yavando bhavaha murtimadam dehe tavando loge, yavando loge tavando dehe. We are a part and parts of the external cosmos. And Desha Vichara is an important cornerstone of Ayurvedic principle. We have divided the all physical geography into 3 zones of Jangalam, Anubam and Sadharanam, and there are further definitions into 7 by the later writers of Ayurveda like Surapala of Vriksha Ayurveda, etc., which has explained the different kinds of geography and how it has to be in tune with people who are living in that there. And we also talk about Deha Desha. When we talk about Desha, we don't say only Bhumi Desha, we talk about Deha Desha. Body also is a part. And the body, that is a human being, we say that Bhumi Deha Prabhedena Desha Mahuriha Dvidha. There are 2 types of Deshas. One is the external place and the internal place. These 2 are in tune with, when they are in tune with each other, there is perfect health. And we divide the Kala, that's 3rd important component. We said Kalo Hinama Bhagavan. The all Kala, time is taken as God himself. And Kala is divided for phenomenal life into 6 zones. And we clearly explains what are to be done in 6 climatic seasons that is coming in a circular way. And we say that Shidodbhavam Doshajayam Vasande Vishodhen Grishmajam Abragale Ghanate Vashagam Sammek Prapnodi Dogan Rudujan Jadu. This is very clear-cut advices given for public health. And it says that the Shastras is Shasyade, it gives orders how to tune yourself. And it says that when dosha also gets accumulated in the body and how it can be corrected by tuning ourselves to the world outside. And primary health care, when we say that one of the important aspects of public health is primary health care, how primary health care has to be started. And we say that Yasmin Deshe tu yo jadaha tasmin tada ushadam hidam. Every geographical place is blessed by nature in such a way that things needed for that place is available in that place. We don't have to run around for that thing. And only thing is that we say that amandram aksharam nasti, nasti moolam anaushadam, arogya purusho nasti, yojagas tatra durlabha. The person who knows how to put these things together are very rare. We need yojagas who can put these things into order and put it in a way which can be used and assimilated by people today. And Ayurveda considers the human being as a whole and advise regime that are most suitable to that person. At the same time, it also gives sound advices to the community as a whole. So there are 2 levels of appreciation. Once it says that if you are a Vada Prakriti, if you are a Pitta Prakriti, if you are a Kapha Prakriti, what are the proneness of diseases of that kind of particular individual? What are the precautions one should be taking to understand? And what are the symptoms, early symptoms, prodromal symptoms that is indicative of genesis of disease at very grassroots level? These are the different layers of knowledge that is available in the Ayurvedic texts and Ayurvedic teachings, but which has not got translated into the action plans of public health program. I believe to apply Ayurveda in public health today, one has to break the monocultural model of Western bioscience-based new view of public health and approach. Actually speaking, this asks for a kind of paradigm shift. Unless we prepare ourselves with a new model of public health, which empowers individuals to take care of their health at the basic level and remove the mindset of perceiving medicine as something in the shelf of the pharmacist, then only it can happen. I'm just taking you back. No, we, in our own childhood, there was a relationship with we and the nature, the people and the nature. We used to think whenever there is a basic health problem, we never think about a pharmacy. We will think about the kitchen. We think about our cooking methods. We think about the diet. We think about a few herbs that are available in our courtyard. That is completely getting eradicated because no element of that knowledge is anywhere in our syllabus of any levels of education. So we are far away from the rich cultural heritage we are having in the form of teachings of Ayurveda. I think to approach public health from Ayurvedic perspective, we should start with the concept of home remedies and food as a medicine and medicine as a food. In the great system of Siddha, there is a saying, Unave marinde marinde unavu. How it is used is the question. And the remedies that is available with our grandmas are the elements, the basic elements of Ayurvedic public health approach. I would like to introduce one of the most profound method of immunization that is being very clearly explained, one of the basic texts of Ayurveda, which has gone completely unnoticed from the Ayurvedic fraternity, which has got reproduced by a 15th century textbook by the name Arogya Kalpadrumam of Kerala of Kaikulangara Ramavariyar. It gives an excellent method of immunization of children from the day 1 to the 12th year. When I say this, you should not get surprised at how one can follow for 12 years. The prescriptions are so simple, so easily available things and very easy to administer. So there was a method which is known in the name of Pragara Yoga. Pragara means in Sanskrit a barrier, a kind of a wall, which prevents the diseases to attacking the infant. And there are methods from the day 1 to the 12th year. I have given all the details which can be made available. We will be publishing this all methods so that people should make use of it and follow it up on this. This is one of the important immunization method which is in tune with the body's rhythm. When I say this immunization method, why I am giving more importance to this method is that here is a method which is making the body's biodynamic mechanism in constant equilibrium. That is the principle behind that. It is not adding a new element which is not in tune with the body's metabolism, which is correcting the body's metabolism in a way so that the body's metabolism in a sustainably biodynamically in equilibrium, and it is in perfect physiological process so that the body cannot accept any external disease mechanism to intrude. This is the beauty of this Pragara Yoga, which is one of the important immunization method told in Ayurveda but never practiced by Ayurvedic community. I am not explaining the details. I have brought it to inculcate a kind of curiosity in the minds of the people who have come here. From this point, I would like to take you to the Ayurvedic approaches that one also should look to the concept of water purification, the method, different kinds of processing water, the therapeutic qualities of water of different sources. All of us take water as a single element of H2O. Many people come to me that I am keeping on adding weight, but I don't take any other thing. But I ask them, they are taking water, unboiled water. When I find that the boiled water and unboiled water, there is sea change in physiological action as per Ayurveda. And many of the things, accumulated toxin can be removed by simple intake of lukewarm water in a climatic condition like in India. So water purification, water is an important component. In 1950s, you may remember when the Renaissance, the changes was taking place in the Chinese Republic, two slogans brought by Mao. The one was boil the water, kill the flies. That brought down drastically the epidemics into 50%. Only 2 points, boil the water, kill the fly. That was the slogan. And boil the water is one of the basic advice that Ayurveda always gave. All these concepts give an idea of Ayurvedic approach to public health. And Ayurveda, as many of us think, that not physician oriented alone. It has got 4 components, and it gives importance to the other 3 components also to make the management successful. And physician, attendant, medicine, and the patient, these are the 4 components, and the involvement of the person here, the person is very important in public health. We believe in strengthening the understanding of the person, strengthening the responsibility of the person through methods of education. So I believe a model of Ayurvedic public health should start from the home remedy kit, which has been in vogue. There was a tradition in India where we used to have a traditional home remedy kit at home, where our elders in the family were aware of how to use it, and made out of simple ingredients that is available in our own kitchen. A herbal garden around the house with local medicinal plants, a community herbal garden which we used to have in the name of sacred groves, and so many other religious and spiritual based traditions. We had developed a method of safeguarding the biodiversity of that area so that people who need can avail it and use it. And also we used to have a village healer all the time. We used to have a village healer who is aware of managing the conditions of that area, and he was profoundly informed about the conditions of that area, was aware of the plants that are available. He was aware of the simple methods of processing it and giving it, and people used to respect him. People used to keep him active and alive by supporting his needs by way of means of things which are needed for him. This system, this institution, these are the institutions, traditional institutions that also are getting eroded. And the old women in the village who has been part of the women's life. No women can live in the village without that support of that old lady who is aware of the antenatal care, who is aware of the safe delivery, who is aware of the postnatal care, who is aware how to increase the breast milk in case of difficulty, who is aware of so lot of things in tune with the women's health needs. This institution also is very fast eroding. So these are some of the elements of public health in Ayurveda. But if you look at the social setup of modern society, these elements have no place or respect. I don't think there is a reason for us to follow completely, blindly the Western model. India, countries like India, not only India, has got rich traditions. Our villages are even today active and contributing and profound with their information, knowledge and resources. Can we put it together through a mechanism of public health where government take an informed decision, informed planning, not named by Ayurveda or anything, named by the people's knowledge, where rich elements of public health are available, so that we don't have to depend upon external institutions given by the government as we give something to the beggar. We can be self-reliant, self-sustainable and self-contributing to our own health. Unless we question the present model and seriously look for alternatives, there will be no breakthrough in public health. Because it is not told by me. The people at policy will say, after 50 years of implementing the public health based on modern science, the infrastructure that is modeled on the Western models, we have not yet reached above 30%. And difficult areas, hilly areas, poor transportation areas, the reach is as low as 3. It would have improved by NRHM kind of program to little bit, 5%, 10%, 20%. But there is no plan. Even after 50 years of spending double the amount, we can reach the 100% of the poor Indians if you follow the present model. But there exists a model which is partially proven by countries like China, countries like Korea, countries like Vietnam. They have taken cue from their traditions. with a political strong will, they have put that into action and implementation, and they have shown us result, and we should follow even though we are late. I think as a nation, we have to take a decision, and we should ask ourselves where the model we have been following is the right, and in a time, so many other spheres of development, countries, so-called countries of developed nations are looking India for leadership, an area where we are 5,000 years ahead of all other countries, should take the leadership to show the world that we have got a way, we have got a means, we have got a model. This is my humble expression for the need of public health based on system like Ayurveda. Thank you. Namaskar.